I wouldn't call them side effects, but yes, I mean, for every type of renal replacement therapy that we have, there's pros and cons. Remember, this is a life-saving treatment, so we're able to give our patients more life, and so they can do, basically live out their life and do whatever they want to do. But there are some pros and cons to each type of dialysis. So let's talk about hemodialysis first, because this is the one that most people are familiar with. So the hemodialysis, again, this is the one where we clean your actual blood. With hemodialysis, since we only do this 3 times a week, imagine we have to kind of fit in all of the work that the kidney does in about a day and a half. We compact that into 3 to 4 hours. So yeah, the patients will sometimes leave the unit feeling a bit tired and weak, but the next day they usually recover and they feel fine, and they don't have to go anywhere that day. They don't have to do dialysis. Now, depending on what type of access they have, and by access I mean how do we get the blood out of your body, right? So we need a way to get the blood out of the body, and that is called, usually we do it through an AV fistula. That's a connection we can do in your wrist or in your arm, and we place the needles there. The AV fistula can sometimes have some problems, some mechanical issues, which are fixable for the most part. They very rarely get infected. What we really fear with hemodialysis, in our patients that have to get dialysis through a tunneled catheter, this is basically sort of like a straw-looking thing that comes out of your chest. These catheters can sometimes get infected, and that can be life-threatening as well. Now, of course, we treat it as soon as we detect any problem with the catheter, but these are some of the complications that we may see. With peritoneal dialysis, since our patients also need to have a catheter in order to get the fluid into their belly, so these catheters can also get infected. It can be also life-threatening. Now, the benefit of peritoneal dialysis is because it's a nightly treatment. Our patients are usually a little bit less tired with their treatments. They tend to be more energetic, and they usually use the daytime to go about their everyday activities. So, for example, we have patients on peritoneal dialysis that continue working, going to school. So it does allow that freedom, a little bit more freedom with your time, because you're not as tired as with hemo, and because it's a daily treatment, it's slower. It's more similar to the natural kidney. That said, it does require a lot of participation on behalf of the patient. They need to get trained, they need to get well educated. But yeah, basically those are the kind of the pros and cons of each type of dialysis.